Hi guys, welcome back to the Just for Today podcast, where we dive deep into uncomfortable topics with zero filters. My name is Adriana, and today I have Dina and Julie here with me. Hi ladies.
Hello.
Thank you so much for being here.
Glad to be here.
Dina and Julie are EMDR therapists, and they actually have a location here in Gilbert, right? What's the name of your location?
EMDR Transformation Counseling.
EMDR Transformation Counseling. So they're here to talk to us about EMDR. We're going to get into ketamine a little bit and just questions from followers. So first of all, why don't you ladies tell me a little bit about yourselves and how you found your way into this work?
So I'm Dina. I've been practicing for about 24 years now and did talk therapy for probably half of that and was really burnt out and really questioning, my own worth as a therapist, that people were coming back repeatedly for the same issues. And I had just met someone who was an EMDR therapist, and they said, you really need to get trained in EMDR. Like, it will change your practice. It will change how you feel. It'll change how you think. And at the time in my life, I still am, but was single and really scared to make that jump. It was a huge financial commitment, and I didn't know if I could do it. And about after a year, cases were getting harder and more complex, and I didn't know what to do. I knew I needed more. I'm like that. I love to learn. So I took the program, and it was life-changing day one for me. Just in my experiential part of it, day one was something that was deep for me, that changed the way I thought, and it was just gone. And I dove in. I was like, I don't care what it takes, I'm in.
Yeah.
And that started my journey.
Yeah. Did you do any EMDR therapy before that?
No.
For yourself?
No. I had no experience with it. It sounded kooky.
Yeah.
It sounds so
It
kooky
sounds
at
right.
first.
People
Yeah.
explain it to you, and you're like,
Yeah.
come on, like, is that magic? Or, right, everyone goes to, is it hypnosis?
Right.
What's gonna happen? I just didn't know. I didn't even know.
Yeah.
And that first day in training, it's like a fire hose of information. But you have your experiential that first night, and you get paired with somebody, and you have to do your own work. And it took me somewhere where they said, that's really heavy and deep. And it kept going there, and they let me go. And I can't even explain how that changed my life. It makes me emotional because it was such a big thing that was gone. And I dove in. I was all in.
That's amazing.
Yeah.
Thank you for sharing.
Yeah. How I got started. My journey was really similar to Dina's in that way. I've been practicing now for about 20 years, I want to say, and I have been an EMDR therapist for probably 13 years, of that. I was working at an HIV clinic, and a lot of my clients were, they had been on the older HIV meds, and so a lot of them were sick, and they were on disability. And so they would come in for therapy and each week, and they really didn't have a lot going on in their lives. And sometimes when people are on disability, they get kind of stuck in this place where, like, well, maybe I could get a job now, but now I start over in the workforce and I make some money on this disability. And so they get in this place where it's hard for them to get out of that rut, even if they start to feel better. So a lot of them are in that rut place, and they would come in every week, and we would kind of talk about the same thing, and it was talk therapy, and it was boring. It was boring, and they weren't changing, and somebody suggested that I get EMDR trained, and I thought the same thing as Dina. I literally was like, this is some tinfoil hat stuff right here. Like, it's really wacky. But I went in, and just like Dina, I was all in. In the first weekend of the training, it's a 50-hour training, and in the first weekend, you do an experiential, as with every EMDR training, where you take turns being the therapist and being the client, and you bring real issues. And so I worked on an issue, and for me, it pointed to something deeper that I needed to work on, but I wasn't really super comfortable in the room to work on that because my supervisor was there, and it was like just too personal, like just didn't feel like safe and comfortable. So we dipped a little bit into it, but that night I was like online looking for my EMDR therapist, and I started doing it. But after the first weekend of training, they tell you, you go to work on Monday and you start doing this protocol. You're only halfway trained. It's the first weekend of 2. And you start doing this protocol. It's like a 3-day and a 3-day. Well, back then, or the one we did was. So yeah, you start on Monday doing EMDR with your clients, and you have a script that you're reading with your client. And I mean, luckily these clients, they really, they had, a relationship with me and everything. And so they had faith in me. I'm like, okay, so now I want you to do this. And so they trusted me. And what was amazing is they started making changes in their lives. And I was just
amazed.
Yeah, I was so amazed. It was they started changing their lives, and some of them got jobs. They went back to work. They stopped drinking. They were having life-changing moments. And that's when I was like, bink. And so I embraced it fully as I went and joined another practice in Gilbert. That's where I met Dina. That was an EMDR practice, and we worked there together for 6 years before we opened our practice that we've had now for almost 6 years.
Wow, that's amazing. I love that. Yeah, it's really funny that both of you ladies talk about how, when you're like, oh, why would I do EMDR? Like, you think about it as something like, kind of crazy. It's funny because I did EMDR, I think it was maybe 10 years ago now, and I loved it. Like, it was really life-changing. It was amazing. And when people ask me, well, like, what is it? I'm like,
it's really hard to explain.
I don't know how to explain it, and I don't know medical terms. I'm like, the way I explain it is like, there's trauma that you cannot remember, and when you're doing this, it's literally taking you back to, like, you're reliving things. Like, you're standing there in the room watching these things happen to you, and like, you're like, oh my God, yeah, that did happen, but like, I don't know how, like, it just happens. And then it just makes you feel better. But that's my description when someone asks me. So I'm like, I don't know, just do it. It'll help you.
Or you even have like body memories, right? Where you can feel it in your body.
Yep.
Yeah.
It's crazy. I loved it. It was really intense, but definitely good for trauma. Yeah. So that brings me to where I want to start before we even get into EMDR. What is trauma?
Trauma is, do you have a good definition? I feel like you have.
It's so interesting, right? People say trauma, right? And so we kind of narrow it down and describe it a little bit different to our clients. We call it like big trauma. Like, you have some single incidences that just take you outside. We call it your window of tolerance, right? Where you're emotionally dysregulated. And those are usually single events. And they can be accumulative, but big events. And then
we big T trauma, right?
And then we have little trauma. And those are the things that are cumulative, that are things that are too big for us to handle emotionally at the time they occur. They get maladaptively stored. And they can be reoccurring. They can be things of neglect, abuse, bullying, negative self-image, right? Our own projections of self. So it doesn't have to be what people think of as these big incidences always, of just how our brain stores memory. And learning the difference, I think, to a trauma of how your brain functions, from a scientific standpoint versus what we just think it does, was really helpful in understanding trauma.
Yeah, and it's hard too because I feel like people experience it differently. Like you said, everyone's reaction is different.
It is different. I think the very simplest definition of trauma I've ever heard is a threat that you're not prepared to handle.
Yes, that's beautiful.
It's just, that can be anything to anybody, right? Like you said, like, it's just different for each person. So it's a threat that you're not prepared to handle.
Right. And what would you say happens in the brain when trauma occurs?
It gets trapped in the brain. Trauma gets trapped. It gets fragmented into different parts of your brain. It can be held, like I said earlier, in body memory. It can be held in emotional memory. We just have this anxiety that we can't let go of, right? Vivid, imagery kind of memory, narrative memory. So it gets trapped in different parts of the brain and it doesn't process through like regular memories do.
Right, right. I'm trying to think of how to ask this question. What, like, would you say that your body can remember things from like birth? Like if you had trauma when you were a month old, 2 months old? Yes. Okay.
And intergenerational trauma as well.
Okay. Okay. Interesting.
Yeah.
And I'm sure you can
Epigenetics.
get into that in when you do EMDR.
Oh, absolutely. Yeah, there's actually a protocol called the implicit protocol. Is there another name for that? The implicit, or is it just the implicit?
Implicit.
I thought there's another name, but developed by Sandra Paulson and Katie O'Shea. When there are no words, they developed that protocol, and it's a really great one for doing that implicit memory. So this is something that's a sense of knowing that we just have. We can't necessarily. We don't have a
Identify,
verbal, narrative memory of it or anything.
Right. Right. Interesting. Yeah, I bring that up because I actually had someone who was talking to me about how she goes to EMDR therapy, and she mentioned that she's like going through right now, like when she was a baby, that she was sexually abused by a family member, and she's like unpacking and uncovering all that.
Stored in the body.
I'm like, that's crazy.
Under the age of 3,
Yeah.
really is stored in the body.
Yeah. Yeah. And another thing too, my youngest, well, all my kids were really young when my husband died, but my youngest she just turned 1. Maybe she was 13 months. And that's a comment I get all the time about like, oh, like, she won't remember him. Like, she'll be fine. She's probably going to be like the one out of the 3 that like won't grieve as much, right, as them. Like my son was 2.5 and my oldest was 4.5, and even my son doesn't remember his dad. He was 2.5, but I'm like, no, I don't. Like, she feels it. She knows, and she knows, like, yes, she was only 13 months old, but she feels the trauma and she feels the grief, and now she's 4.5, and you can just tell by certain behaviors and things that she does, but I'm like, yeah, I don't think you're too young to remember.
Fascinating as kids, I think, like when we look at the brain, and like our brain is to keep us alive. And right, as a child, your parents are there to make you or to keep you alive, right? You need them for survival.
Right.
So when one's missing, you feel that sense. You don't have words because they don't have words.
Yeah.
We have to teach them those words.
Right.
But they feel that loss.
Yes.
And then how does their own brain make sense of it? Because our brain doesn't like open-ended statements.
Yeah.
It needs closure.
Yeah.
So as kids, right, they're going to find their own closure, and they could be fine because they found positive closure, and they could not be because their brains found negative closure, right?
Yeah.
Yeah.
And how that manifests.
Right. Yeah. I always say, because he died, and then I could not parent. Like, I was just not in it. So my dad actually quit his job to help me take care of my kids, and she's like so attached to him even now because he was there like all day, every day. So I feel like once I, kind of got myself back and I got back in my routine, and like when I would try to like discipline her, she'd be like, who do you think you are? Like, where have you been? Like, you weren't here basically my whole life, and all of a sudden you want to be a mom? Like, I feel like she feels that, and I can tell. So it's like, I'll kind of be a little, not easier on her, but a little more patient, because I'm like, okay, I feel like she got the worst of it because I wasn't there when she was a baby,
Yeah.
But those are
We lost
things
two
that-
parents.
Yeah, exactly. So I'm like, those are things that I don't even think like we all realize that's happening in her body, is trying to deal with all this, and it's just a lot. But yeah. So getting back into EMDR, can you ladies please explain exactly what EMDR is?
A lot of ways to describe EMDR.
You're
You want
good
me
at
to
this
do
part.
one?
Yes. Yes.
Well, we talked about this earlier. When a traumatic event occurs, it gets stuck in different parts of the brain. This is the simplest way to describe it that I could think of. So trauma gets stuck in different parts of the brain, and when we use EMDR therapy, we're using bilateral stimulation primarily to unlock the trauma trauma, and we're really we're bringing on all different aspects of how we're holding the trauma in our nervous system, right? So we're bringing on images, negative self-beliefs that are stored with that trauma. We're bringing on body sensations and emotions. We set up what's called an EMDR target that highlights all of those things, activates those different areas of our brain, and then we use that bilateral stimulation to allow the left brain and the right brain to have a conversation and to process those traumatic memories through, just like we would process anything else. So that's kind of the simplest way to describe it.
What are some things that you can use for that? Like, I know there's different ways. I mean, I used the vibrating
Buzzies.
We call them the buzzies. Yeah, they're called tappers or buzzies.
Yeah, but I know some people can tap.
There's so many ways. There's the old school way is the light bar, and a lot of people still like the light bar. It has a light that goes across it, and it's in front of you. It's just a bar with a light that goes back and forth, and you just follow that. You can use what we like to use is a wand. It just makes it easier instead of like traditional eye movements where you would be somebody would be tracking those eye movements back and forth. It's just a wand, and it makes it easier on your wrist and
shoulder.
On your shoulder and all of that. You can tap on the outside of someone's knees. You can, it's endless. And online therapy is really great too, virtual. We have a wonderful app through bilateralstimulation.io that we use that has a little ball that goes across the screen.
You can do it virtually.
Yeah.
Oh yeah.
Yeah.
Oh yeah. I
Which
do
is
it virtually.
safer for people because they feel safe in their home.
Yes.
That would make sense.
Or
Right?
I just like it for convenience.
And convenience.
Yeah. When my therapy, I'm like, I'm not driving 20 minutes. I don't have time for that.
Yeah.
Like, I want to get it done.
And not waste time in between.
Virtual for my own. And then I probably do the most telehealth at our practice, and I do probably 40 to 50% of my cases with telehealth.
Wow, that's amazing. I did not know that. Why are eye movements involved?
That's that bilateral stimulation. So we're doing eye movements. That's where all the research is, or the main research, the main original bodies of research are all in those eye movements. And it's thought that it is simulating REM sleep, and we don't really know the mechanism, but that bilateral movement helps unlock.
Yeah, you're engaging that emotional part where it's stored, stored, and the logical part, right? So when you're going over that brain barrier, you got both parts integrating and helping each other make sense of it and feel through it together.
Yeah.
Okay. And you mentioned earlier that some people are like, is it like hypnosis? Yes. Yeah. What is your answer to that? What would you say is the difference? Because people hear that and they're like, okay, so you're hypnotizing me.
Yeah. No, it's not hypnosis.
Not at all.
Yeah.
You are conscious. You are in it with us. There is no.
Yeah.
You're not remembering. You're put under nothing. You are.
Right.
Fully aware,
Completely
fully
present. Yeah.
Fully actively engaged.
Yeah. What would you say are the best issues or traumas that EMDR can help with?
EMDR can be, the best, it can be used for just almost anything, really. Really. The fastest, biggest bang for your buck are our single incident traumas, and that's where it was developed from, right? Like, your car accidents and your, like a traumatic assault or, things like that. It really, your house caught on fire, those kinds of things. It's really powerful for those and works very, very quickly for those. It's still a really quick modality, even if you're doing attachment trauma, performance anxiety, doing like any of those other kinds of things as well, phobias, et cetera. It's still very fast compared to talk therapy, but it's really fast for those big single incident traumas.
Yeah. Yeah, so you don't have to wait it out weeks and weeks with talk therapy. You kind of just get into it.
It can be,
right away.
a session.
Yeah.
Can resolve a single incident trauma.
Yeah. That's amazing. And that's good to know too, because I feel like a lot of people say, well, it's really expensive. Yeah, but you don't have to do it as often as you would.
Yeah, it's shorter. Yeah. I mean, if you have attachment trauma, that's years and years of chronic cumulative trauma.
Yeah.
If you have that, that's going to take a while to unpack. I mean, I do have clients that I've worked with EMDR therapy for years, absolutely. But it is faster than traditional talk therapy, and especially if you have specific goals in mind that you want to get out of it.
Yeah. I've also seen that it helps with addiction. How does it help an addict?
Well, addiction is based in attachment. It's really a symptom of attachment wounds. And so that's where we go in and we're doing that attachment work so that people aren't having to seek out symptom relief.
That's interesting. Okay. And this can be with like any sort of addiction, like anything?
Absolutely. And there's so many different EMDR protocols. There's EMDR, and then there's EMDR for this. There's EMDR for phobias. There's EMDR for addictions. There's EMDR for even anxiety. There's specific ones that you can do for different things. Recent traumatic events. There's a whole bunch of them, but there are a couple different specifically addiction protocols to work with urges, sensations that you're having.
What has been the success rate if either of you ladies have worked with addicts? I'm just thinking you also, like, selfishly, because my husband was a heroin addict, which ultimately led to his death. So I did not know, like, EMDR could help with that. If so, I would have been like, let's go and get it done. So
yeah, I mean, you have to have somebody that's willing.
Yeah.
That's a big part of it, right? They have to be a willing participant.
Yeah.
I don't specialize in substance abuse myself. Dina does substance abuse work, or you used to do more? So
that was my whole career. My first 13 years was substance abuse.
Oh, wow.
But it was more of a training and more coping skill based. Right. I didn't know EMDR at the time. I was a new clinician. It was my first 13 years. And that was hard, right? I looked at it very different back then too, right? Like, this is an addiction versus a symptom.
Right.
It's a symptom of you're trying to get a need met, that what's missing, So like, just even through my own career of learning, we don't see a lot of addiction. We see some at the practice. And there may be more that's just not disclosed, but we're working through the issues, and those sometimes dissipate as well. Because we're actually working on these targets of needs, of memories.
I don't think I could really have an educated answer on that because it hasn't really been a specialty area of focus for me.
Right. But I mean,
even at our practice.
I mean, it does make sense because almost every addict I've met has a very large amount of trauma. Like my husband, his dad died when he was 5 as well, and it was he had a really rough few years afterwards, and he had a lot going on in his childhood. So that
hard
makes
for a little
sense.
boy
Like, the
too.
attachment, and I remember when my husband died, I was like, oh my gosh, like my daughter was like the same age he was. And then, my fear of like, well, now they're all going to be addicts, like everything just goes through your brain. So I'm like, okay, well, I need to educate myself, and I need to like do all the things to help them not I mean, at the end of the day, I feel like it's not a choice. You do it because you're looking for something or missing something.
Right, and that's, again, train of thought, there's always trains of thought, right? But it starts out as a need, right? Because most research shows you're 13 to 15 is when it really starts. And you're trying to fill that need, whatever it is. And then your body chemistry changes in time, and we don't know that time. It could be very short, and it could be 30 years of how is your chemistry changing. So it just literally turns off your dopamine receptors, and then that drug, that alcohol, whatever it is, substance, fills that need, right? The brain doesn't know the difference.
Right. Right. Yeah. And then it becomes something you literally cannot live without. Like it's a part of you to do that. Yeah. Well, that's good to know then. So I feel like it does make sense. Like if you do EMDR, it's taking you back to those traumas and it's helping you realize like what is missing or what's going on in your brain that's taking you to these substances and doing that. Yeah. This was one of the questions I got from someone. What is the youngest you can be to get EMDR therapy? She has an 8-year-old. She's wondering if her 8-year-old could
Definitely she could do it at 8. I don't know the youngest age, but 5 maybe?
I think we had a 5-year-old at our practice once.
Amazing.
Something had happened and they had heard about it. And then I did do an RTEP, which is a group. We had a family incident. Or GTEP, I'm sorry. Yeah.
So it's a group traumatic episode protocol. It's one of those specific EMDR protocols.
And one of the kids was 5 and one was 8 that were in this accident.
Oh, yeah.
Yeah.
That's right.
Oh, that's amazing.
It's-
And
They do great. Actually, kids are really fast, really easy with EMDR because they don't have years of baggage.
Right.
like we do as adults.
Wait,
right?
I know what happened.
It is single incident at that point a lot of times for them.
Yeah.
And they move right through it because they metabolize information just like we do.
Right.
Yeah.
But it's not stuck to anything.
So when you do that with a child, do you have to do like multiple sessions beforehand, like kind of talk therapy to like, because you know how sometimes kids just won't, like they won't talk or they're not comfortable, especially like 5 or 6, those ages. Do you have to do like the preparation work? I think it really depends on the child.
Okay.
I think I don't work with children personally, so I don't know what the protocol is necessarily, or how long that prep work takes for kids, but it is going to be dependent for sure on the child and the child's ability to stay present and all of that.
Yeah. And would it help a child who lost a parent?
Oh, absolutely.
Grieving kids.
Oh, yeah.
Yeah.
Without a doubt.
There's some great ways with kids that they don't even know they're doing EMDR. But we're setting up the targets with toys, pictures of their emotions, words that are beliefs, and they're picking, right? And you can put them buzzies in their pocket. You can have them look across so many things.
You can use like little magic wands,
Yes, bubble stuff, like so many cool things for kids.
Yeah, it's actually very cool.
Yeah.
Oh, I'm really interested in that now. I'm like, let me get all my kids in there. Because I love EMDR. It's amazing.
It is amazing.
It is,
It's one of my favorite things. My fiance did it as well too, and he's like, yes, it's been the best thing. Like it's life-changing. Yeah.
It is life-changing.
Yeah, so absolutely. I do want to talk about ketamine for a second because you guys just got approved, right? You're doing that in your office now. So what made you want to do that? What made you want to bring in ketamine?
I was actually contacted by a provider who prescribes ketamine, who I used to work with, because we share some mutual clients. And she suggested for these 2 mutual clients that we have that they would benefit from ketamine-assisted EMDR therapy. And she sent me the link to this institute that we got our training under, the Ketamine-assisted EMDR Therapy Institute. And we'd already been talking about it, and we worked with Advanced Wellness and Pain and had partnered with them, and we have some friends that own another practice that they do it there, and it's just becoming a bigger thing.
Yeah.
So that was the perfect invitation, you know, and so we jumped on and we did the training, and I've been doing it with those 2 clients and other clients as well. Our first responders are very excited about it, and we're doing it with so many of them now.
That's amazing.
But so that's kind of how that got started.
Yeah. So what exactly is ketamine therapy for those that don't know? How would you explain it?
Yeah, so there's ketamine-assisted psychotherapy, and there's different types of ketamine-assisted psychotherapy. The one that we are specialized in is ketamine-assisted EMDR therapy. Okay. So a lot of people are familiar with ketamine as a psychedelic medication, right? That you kind of go on a journey and you heal that way through maybe an IM injection or an IV, right? And that's a higher dose of ketamine for that psychedelic experience. experience, and it's not always accompanied by psychotherapy. Sometimes it is and sometimes it isn't. The therapy can be after the ketamine journey. For our training, it is, or for the program that we're using, we use a psycholytic dose of ketamine. We have a prescriber at our practice now, and the patient goes to a prescriber, and they give them a prescription for a low dose. The psycholytic dose is like 50 to 75 milligrams. And it's psycholytic is where it's not psychedelic. It's where they can just kind of go deeper in their work. And so it's extremely exciting for us because we love EMDR. We already live and breathe and work everything EMDR. And now we're like, wow, we can add this low dose of medication that helps a client drop in. They self-administer the medication in your office, and we're done in a 2-hour session, 90 minutes to 2 hours. And they just drop in deeper to their EMDR experience. They don't have to wrestle with all those protector parts that get in the way, that kind of shut us down, distract us, all of that. They can stay in the EMDR target and they can really be focused on it.
Yeah, amazing. So for those people that are interested in ketamine or EMDR and there's, nowhere around them that does both of them, how would they know which one's better? Like, what would your recommendation be?
For ketamine or EMDR, or ketamine-assisted EMDR therapy versus just doing traditional EMDR therapy?
So just if I don't, let's just say someone's out of state or something like that. They're looking for a type of therapy and it's like, okay, I can either do EMDR or I can do ketamine. What would you recommend? What would be better? How would they know? Is there certain traumas that work better?
Yeah. I mean, we're specialists in EMDR. We're not specialists in ketamine psychedelic journeys, right? So, I mean, I think we can only speak so much on that topic by itself as a separate modality. But in conjunction with EMDR therapy, it really depends on the patient and their readiness, the kind of work they want to do.
I wish I would have done that when I was doing my ketamine.
And there it goes with education, right? Like, so if someone calls us and it's like, which we've had, right? I want to do ketamine and EMDR. And as we're getting into this new realm for us of, okay, we need to meet you. We need to see what's going on.
To do an assessment.
We need to see how you process. Right? Some people process beautifully with EMDR and they don't need that extra. Right? It's an added for people who are very logical and cannot get out of their head, right? That ego is so strong. People who have really deep stuff that they're just emotionally, it's too big to handle. It drops them into where you kind of have this experience like you're watching it and it's not overwhelming you. And you can go through it. Yes.
It's a very gentle approach.
So, but not everybody needs that. Some people can process beautifully and that's all they need.
And you also mentioned that you have is it troches? I know I'm going to troches of ketamine.
That's how they self-administer. So the prescriber prescribes them, and they in the EMDR session we'll start to set up our EMDR target, which is where we're choosing what we're going to work on, and then we're going to learn how it's stored, right? So we're going to identify what was the worst part of this trauma for you, what picture do you see in your mind that represents this worst part. What belief did you develop about yourself as a result of that? Is that like, I'm not safe, I'm powerless, I'm not good enough, or, something along those lines? What negative belief did you develop about yourself? What would you rather believe about yourself? What emotions are you experiencing as you remember this memory, and where do you feel it in your body? So we get all that online. That's EMDR phase 3, where we're setting up our EMDR target. Once that target is set up, the patient self-administers the medication, and for 8 to 10 minutes they are swishing the medication around in their mouth. They're not swallowing it. and they're having an internal experience. Kind of close their eyes, and they're just swishing, and they're just noticing what's happening in relationship to the target we just set up. And then once that 8 to 10 minutes is up, and we're with them every step of the way, of course, they spit the medication out, and then we ask, what did you notice? Like we do with traditional EMDR therapy, and then it's an EMDR session. What did you notice? Okay, we're going to do some bilateral stimulation now. Okay, and you're just going to go with that, and we're going to go through the rest of the target that way. And they're able to access deeper. They're able to feel a more gentle experience.
Yeah.
And they're just able to resolve things faster, and they have that neuroplasticity, so they're not in this rigid space with it. It's so exciting.
Yeah.
We're loving it.
That's really interesting.
That's really cool.
That's amazing.
And it's relatively inexpensive.
Yeah.
That's the other thing. Yeah. Doing the ketamine journeys are more expensive. It's relatively inexpensive. Yeah, I'm really personally excited about it because I have clients that I've worked with for years. In fact, the ones that were recommended that we do this together, they're doing it. And have another client that we're getting ready to do it with, and we know exactly where we're going. We're going to inaccessible targets, working on things that people could not get to before because it's too big and too deep.
Yeah,
So
like we can finally help and figure stuff out.
Yeah,
And
it's just such a beautiful, beautiful piece of work you can do.
What would you say to those people that are just afraid to relive, I guess, afraid to relive or afraid to know what they don't know, like uncover things?
What I say, I don't know if you say the same thing, is you've already been through this before.
Yep.
And now I'm here with you, and I'm going to help you get that out of your body. I'm going to help you move past this now.
Yeah. I think one of the things I hear a lot too when I talk to people about EMDR, if they're like kind of shying away from it, it's that like, I don't want to go through it again. I don't want to live through it again. I don't want it, like to come up again, and then I'm going to be right back in that place. But I think it's important to know that that is what helps, right? Like
There's
going
something
back to
on
it.
the other side of that, and now we're releasing it. Because otherwise, if we just take it in, stuff it down, we sweep it under the rug, we have a lumpy rug. Right? It comes out sideways. It's going to come out. It's going to affect you in your life. That's where our substance abuse is happening, our addictions, right?
Yeah.
That's where our anxiety is coming from. You are reliving it. It is still stored in your body. You're reliving it with your irritability. You're reliving it with your control. You're reliving it with your performance anxiety. You're reliving it. Perfectionism. You're people pleasing.
Yeah.
All of that stuff. You're reliving it every day.
In ways you don't even realize.
Yeah.
And do you want that to go away?
Yeah. And I think sharing with people too, like, you're not reliving it. We do have to start you there.
Right.
Right? That's our start.
Yeah.
It doesn't stay there.
Right.
Right? There's an ownership with, yes, I got to get here, and it's scary and big and hard. And we don't always stay there.
No, we move forward and we
I think
start
that's
building
really,
insight.
I
Yes.
think that's really important to know. Is like you start there, but you find a way to kind of own it, and
You're going through the memory network,
Yes.
and you're going through the emotions. You're going through the
releasing it.
logical part the information you have now that you didn't have back then. They just
That's the
don't
key
know
part.
it, and it is scary.
Yeah, because you're not 5 anymore.
Yeah.
Right?
Yeah.
Or you're not in that accident anymore. That already happened. That's in the past. And so what we're doing is we're leaving the past in the past. We're taking the lessons learned from it now, and we're leaving the past in the past instead of reliving it every day. Car accident people, they're the people that are your passengers in your car that start putting the foot on the brake or whatever, or they hold on to the oh shit bar or whatever when you're going around the corner. They're reliving car accidents. Their body's holding that. Yeah, we can reprocess that. And it's a really good illustration of how your body holds that when somebody that is not driving tries to put on the brakes.
Yeah, because you're not even like it's just natural. Like it just happens. Your body just does it.
It's prepared now.
Yeah.
When there's nothing to be prepared for
Right.
in that moment, right? Hopefully.
Yeah, but that's what your brain and your body's telling
And you
you.
get to let that go.
Yeah.
You get to let that go.
That is a great one. I've had a couple clients with car accidents, and even they come in not even knowing that was a thing, but it comes up in a conversation of, oh my God, my daughter was driving, I was teaching her to drive, and she hit someone, and now I'm so nervous. And I was like, Target, right? And then it's gone, and they come back and they're like,
great.
I just drove with her and didn't even think about it, right? I'm like,
That actually happened to me.
yes.
My son was driving and pulled out right in front of somebody. He turned right in front of somebody, totaled my car, and it was really scary. Everybody was, mostly okay. But after that, being a passenger was really hard for me for a little while. And luckily, one of my good friends is an EMDR therapist trained in the recent traumatic episode protocol of EMDR. And she came over to my house. I was still recovering and did that protocol with me. And it was a freaking game changer. Total game changer.
Oh,
But I was that passenger for a minute there.
Yeah, that's amazing. That's good to know. It can really heal so many parts of you, things you don't even know that are related to certain things. Yeah, that's amazing. I do want to talk about attachment wounds for a little bit here. What is an attachment wound for those who don't know?
So attachment wounds can be anything that happened really young, right? When we're in this kind of fight or flight state, and our brain doesn't feel safe, doesn't feel connected. And so we go into these protective parts to protect ourselves to survive, which is usually, right, our caretakers or people around us have either died, abusing us, hurting us. And so we push away to protect ourselves to survive. And so as time, that becomes like the lesson we've learned, right? That's the imprint in our brain and what we're used to. And those usually reoccur, just deepening that sense of protection, and then how they play out as we age.
Yeah, so they're really adaptations, right? So we learn how to adapt to those wounds, right?
Yeah.
So if it's not safe in this room, I come in this room and my parents are fighting all the time in here and it's really scary, I run away because I don't know what to do. I go hide, right? Or I just shut down and freeze. I just shut down and freeze because I want to be invisible right now. Right? Or I fight. I go in there, why are we fighting? Stop fighting. And I get involved, right? So we have these different adaptations that develop, and those continue through our life. We learn how to adapt by escaping, by fighting, by freezing, right? Fawn. Like we adapt in those ways, and then in situations that look like, smell like, feel like what happened before, we respond that way. And what happens when we're an adult, we're not a child anymore, we find that those adaptations don't really serve us, right? They don't really, we now can develop skills to be able to have a conversation with somebody if there's conflict. We don't have to shut down. We don't have to run out of the house and slam the door and scare the kids, right? We can actually stay in and have an adult conversation. Yeah.
Right. And would you say attachment wounds are usually created only in childhood, or can you get those later on in life, like in different relationships?
I mean, you can in different relationships. Yeah, certainly. I mean, a lot of them stem from childhood, but yeah.
Yeah.
I mean, what do you say to that after losing your husband?
Yeah, I mean, I can definitely see some attachment wounds and like triggers there that, not even like losing him, but being married to an addict.
Wounds from a lot of different ways.
Sure. Yeah, where I'm like, oh wait, I have to like tell myself that's not happening right now. Like that's okay. It's not like, like just.
That was then. This is
little
now.
things, Yeah, like it's like, okay, I don't have to be crazy. Just be normal. Just be normal. Why do people repeat unhealthy relationship patterns?
I think it's kind of what we just talked about with the adaptations, right? It's how they've learned how to adapt.
So it's normal to them.
It feels very familiar, right? We can get into these relationships that are unhealthy that just feel like relationships that we've had before.
Yeah. And I think it's interesting too, because I mean, I know grief and trauma obviously both do so much to the brain, but I feel like after I lost my husband, I'm just like a completely different person.
Sure.
Just living through that, you know, like now I'm just like, I want different, and I know like what not to look for. And like right after he died, I was like, I love my husband so much. I would have been with him, obviously, like if he was still here. But after he died, I was like, I'm not looking for anyone like him. Like I don't, and it hurt me to say that, but I was like, I just know now what I don't want going through certain experiences. And yeah, your brain and your body just change, and I feel like living through those traumas help you do that.
That's how we learn,
Yeah.
right? We don't really learn we don't learn lessons when things are good. And, you know.
Not lesson. I mean, we learn a lot when things are good,
yes,
but
yes.
I think I know what you mean, like hard lessons.
Yes.
Yeah.
How do we really change and grow and reflect the stuff that happens that's hard? And we get a different perspective, and we get to look at, like I said, how do I look at that for me? And how did I get in this? And what is it I want from it? Or do I want something different? Like so much comes from, you know, negative events or hard lessons that if we can embrace those and stuff at times, we grow from them.
Yeah, absolutely. Would you say, like, if someone goes in to EMDR and they're healing an attachment wound, can that just like flip their life upside down? You know, like, can they, like, you know, let's say they're married and they're doing all this, and then they go through it and they're like, I don't want this anymore. This is not what I want. Is that a big outcome?
It can be possible, yeah. Because when we start to change, I do couples work, so I always, and it's just my belief too, doesn't mean it's factual, I tell them in the beginning when they're doing work on themselves, if they're in a relationship, and what we're working on has to do with the relationship, that I will always bring that other person in and share what EMDR is and how it changes, and the person that you may want or want less of their reactions, when they do that, what is it going to kick up in you? Right? Because it's no longer familiar. You know,
Or when somebody's implementing boundaries and they've never
done
boundaries.
that,
Yeah,
right? Like it will create this dynamic and of, I don't want this anymore. I want more or less. And this person, if they're willing to get work too and work together, it can be beautiful. But when one, which I see both, right? One's like, I'm not the problem. And now this person is setting boundaries and taking care of themselves and doing things for themselves. It triggers the other person. And that can cause conflict. And they're just not compatible anymore. They can still love each other, but not be compatible.
Yeah. That makes sense. That was like the first thing that pops up in my mind, because I'm just thinking, like, obviously for me it took a traumatic event to be like, I don't want that. But if someone's actively working at it or doing the work, you know, you can be like, wait, this isn't what I want.
Right. I want to choose how I want to live my life.
Yeah. Why? Someone asked, why do you feel guilty when you start feeling better? I think that kind of answered it a little bit, though, because you might hurt the people that you love in the process. Yeah.
Especially if you've been actively engaged in people pleasing because you needed to do that in order to survive in your childhood, right? And so now you're doing it automatically. You've adapted that way, and then you find that it's not really serving you anymore. It's not even serving the people that you're people pleasing for.
Right.
It's not serving them either.
But they benefit, and that's what they're used to.
Yeah. So then once you try to change that, it's
Yeah, and you will feel guilt, and guilt's not a bad thing to feel. I think we think negative emotions are bad versus they're informational.
I think for the people pleasers, it is very hard to feel.
Absolutely.
'Cause,
As a
you know,
people
it's-
pleaser.
Yes.
So much.
Yeah. You're like, okay, it's not bad to like stick up for yourself and feel guilty, but for the people pleasers, it's like, oh my gosh, what did I just do?
new territory.
It's so new. Yeah. Yeah. And then the people that are so used to you are like, what the heck? What's wrong with you? Why are you changing all of a sudden? Yeah. What does a dysregulated nervous system feel like?
I think it can feel a lot of different ways.
Yeah.
You know, it depends on the person, right? So that
Yeah.
can show up in anxiety, panic attacks,
Depression,
yeah,
over-explaining,
Anger
over-functioning,
outbursts.
perfectionism,
Yeah.
anger.
We could go
like,
on and on.
You can go down the whole gamut as we look at symptoms, right? Any symptom that's not serving you or that's just uncomfortable probably is from something, right?
I feel like addiction can go in that too, you know, like, this was another question. Sorry, I moved on to questions. And
You're
I
okay.
didn't mention that.
All good. All good. Yeah.
Let's see. I've been stuck in survival mode for as long as I can remember. Do you recommend EMDR for that? And how do I find a certified one near me?
Excellent question. Yes. I mean, we use EMDR as our foundation. Every person who comes into our clinic is going to get one of the phases of EMDR working towards phase 4 processing. It's just what we believe. We believe it takes care of every symptom, small to big. So, and then you have different levels of training with EMDR. So finding a certified
Is a great place to
is
start.
a great
for
place to
sure.
start. There is a website, Psychology Today, and you can filter through, and you can put, EMDR, specialty, if they have insurance, no insurance, male, female, what you're looking for, and certified EMDR therapist will have it under their name that they're certified, and then above that, which Julie and I both are consultants. So you've gone to the extra level then to be able to train it. So,
Well, and I mean, I think that another easy way to find somebody that's EMDR certified is to go to emdria.org. That is emdria.org. It's EMDRIA.org. So it's the EMDR International Association, and they you can search for certified therapists specifically on there. Or do you want an approved consultant, or do you want a trainer, or what level? Do you just want EMDR basic trained? But we would recommend. I think both of us would recommend wholeheartedly starting with somebody that's EMDR certified at a minimum, because that's somebody who's really shown that they really believe in it. They've put the extra time and the extra work into really learning the modality. Our EMDR basic trained has that initial training, and they haven't done the additional consultation hours. I mean, with that initial training, there is 10 hours of consultation, but they haven't done anything beyond that that they're able to put towards certification. They haven't achieved that level of certification yet.
Right.
Yeah.
Well, thank you for that. Yeah, that's a really good question. People know where to find it. How effective is EMDR for rumination?
I think it's effective for that as well. I think that rumination can be rooted in anxiety, just
fear.
anxiety. So we're going to look for attachment wounds for rumination, right?
Yeah. And I think that also answers, I have quite a few on here that say, can EMDR help with anxiety? So I think that we answered that in the beginning too. That's a big one. Okay, this one's a little more personal. What's the best part about being a therapist, and would you recommend this career?
I love that. I think it's a great career. I think it's a really rewarding career, and it's also kind of an entrepreneurial career. If you want to do things like become trained in different modalities, of therapy or ketamine, or different kinds of things that you want to do, you can do all kinds of things. You can hold intensives. You could do weekend retreats. You could do all kinds of cool things. So yeah, I love being a therapist. How
Yeah,
about you?
I wouldn't do anything else. You know, it was where my heart was when I started, and
You wanted to be a therapist your whole life. I wanted to be a social worker when I was a kid.
I wanted to be a therapist, but at the time I was probably 14.
Oh, wow.
Yeah.
And my journey kind of evolved differently because, nobody believed in me and thought I would be good. So I bought into that for the longest time. So I didn't actually start my career till I was 26. I'm sorry, 32. 32. So
Yeah, same. I was
those
37.
years, yeah,
That just goes to show you can really start at any age.
you can. Absolutely.
It's never too early.
Yeah.
You want to do it, then go
Yeah.
for it.
It's amazing. I've had several clients in the past who had done their own EMDR and stuff and then went back to school to be therapists.
Yeah.
It's so cool.
Yeah,
That's
I can
also
see that.
rewarding.
I can see that because it's
Yeah.
just amazing.
If you get it,
Yeah.
and then you want to help heal.
Yes.
Right, which is what we're so
Right.
good at.
Yeah, because you get it, and then you're like, okay, you need it, you need it, you need it.
Yes, yes.
I mean, probably most therapists have trauma.
Yeah.
I mean, that's how we get into this.
Yeah.
Right. We have our own wounds that we want to heal.
Yeah.
And I know for me, just in my undergrad, I majored in family studies and human development. I didn't know what I wanted to do. I had no idea yet, but I wanted to know what a normal family was. And I found out that my very abnormal family, dysfunctional family, was normal.
Yeah.
We all have
Like, that's
dysfunction, or a lot
what
of us
it's like
do.
for everyone.
Yeah.
You said you worked in addiction, right? And what made you want to work in that field?
I don't think I wanted to. Well, I know I didn't want to. I mean, I was
fell into it.
32 when I graduated, 34 after my practicum and everything. So I was older, and I can't remember if 9/11 had just happened or what, time frame wise. I think 9/11 had just happened. And I didn't have any experience. My practicum and my internship didn't lead to opportunity, and I didn't know what I was doing. And so I thought nobody was going to hire me. I didn't have any connections in the world. I didn't know anyone. I didn't even know where to start, really. And someone gave me an opportunity, and that was the opportunity. And so I took it and jumped in. Just, I don't know if I love having that experience, but it wasn't something I chose.
Yeah. Did you have any personal experiences or people in your life that suffered from addiction, or did you know anything about it when you started?
No.
Was that the first?
I mean, I think looking back, right, there is some family members that did have problems, but I didn't know.
Right.
I didn't even know that that's what it was. So I had no experience when I started. They asked me to put a program together for adolescents on top of it. They didn't have one at the time. And so I just started signing up for trainings. I went to a 4-day weekend in Vegas and just dove. I really had no idea how to do it, how to put a program together, how to do addiction.
First, this is my question I want to ask you. I know this is a debate, ongoing debate with people. Would you classify addiction as a disease or not?
It's funny, in school, there's one of your papers you have to do is if you believe it's a disease, nature, nurture, yeah. What I know and how I feel are very similar. I do believe it changes your brain chemistry, right? So that does happen. If we want to call that a disease, okay. Do I think it's based out of an adaptation? 100%.
All right. Yeah, I feel like it's, I don't know, the more people I meet, obviously it's, like you said, it alters the brain chemistry. So yes, it can become a disease, but it really is just so much underlying trauma that you have not dealt with. It's
Nobody signs up for it.
no. Yeah, and that's the thing too that I get, being on social media a lot, people are mean, and I get the comment of oh, well, he didn't love you, because if he loved you or your kids, he'd still be here.
Yes.
Yeah.
That was a
Or
lot
if-
in my work.
Yeah. So like, obviously, like, why are you so sad? Like, he didn't love your kids. He didn't want you guys. And I'm like, that just shows you that you don't understand anything. Right. Like,
That's a really ignorant comment, actually.
Yeah. Oh yeah, it is.
Yeah.
People online are crazy.
I know.
Well, I think there's a truth to like ignorance is bliss.
Yes.
When I just stay in my
Yes.
little bubble and what works for me is what I know and what I project.
Yeah.
Life looks safe and
Yeah.
good.
Yeah.
And I don't have to grow or push.
Right.
But those are usually the ones like,
That-
you're like, what's inside that you don't want to go to?
Yeah. Absolutely.
That, or it's been studded or shut down, protected.
Yeah.
That there's so much judgment that
Yes.
it's not based on facts, it's
Yeah.
based on opinion.
Yes. Absolutely. And yeah, every time I mean.
Limited understanding.
Yes, absolutely. Like, because they haven't experienced it. And I always say that too. When I get nasty comments, I'm like, well, how lucky of you to not know, because you obviously don't if you're saying things like this, you know? Yeah. Someone here said, do you recommend tapping method for anxiety? It was the first EMDR tool I learned in therapy for trauma. Tapping method, I don't remember.
Tapping, I
learning
mean,
a
there's
tapping method.
EFT, the emotional freedom technique. I'm not sure if that's what they're talking about, where you're like tapping on different, like, I don't even know where acupressure points. And there's a special training in that, and I do believe it can be helpful from what I've heard. That's what I think of with tapping therapy.
Yeah.
Specifically when they say it that way.
Yeah.
There's
Do
a
you guys do
component of-
any tapping in your EMDR?
I'm not trained in it.
No.
It's not an EMDR technique.
Okay.
I mean,
So it's
EMDR.
another thing you do on top of it.
EFT is just something completely different, like
Okay.
yoga or,
Right.
like just mindfulness or, I mean, it's just it's another tool. There is a tapping component of EMDR, so I'm not sure if like there's some, like you can in EMDR therapy, like I said earlier, like, tap on the outside of someone's knees or whatever, or they can put their hands, on a desk and you can tap. Or they can tap on themselves. They can do that for a resourcing technique. Maybe that's what they're talking about, like butterfly taps. Like, this is like a calming butterfly tap.
So, yes, when people think of EMDR, they think about it for trauma therapy and to fix trauma. But you're saying it's not just for trauma.
It's like we kind of shared a little bit. Trauma is so many different things, right? And it's anything we couldn't process that was too big, right? And that can be anxiety. That can be negative beliefs about self. Everything that's stored, right? We can undo those memory networks of where I learned it. And so I think people, it was invented for big T trauma. And we've evolved over time to understand, like, your nervous system carries all those parts to it and they all work together. So we can't separate things. We go everywhere we go. So what we carry inside is what's important to us, and either we have positive consequences or negative. Right. And if we don't like the negative, it doesn't have to be big stuff, right? It can be, I can talk personally. I go into relationships and I have my own familiarity of what I attract to. It's not what I want, but it's what I'm safe with, right? So I have a beautiful life without it. And I know I'm working through whatever is there through my own EMDR therapist to get to a different place for me, right? And nothing big has ever happened to me in relationships. Some of my exes are my best friends. I'm an anomaly in that. But I've never had this big bad breakup or someone died or something. But it's always been something that I know is within me that I want to grow from. So, and for me, EMDR is those little roots of where did I learn some of these things, or where were they modeled for me, that I didn't know it was bad to watch my parents ignore each other. That's just what they did. And how did it affect me? And I have a twin sister who it affected very different. So, learning through that through me, it doesn't have to be big stuff. But the healing is so much quicker when we get those roots and they're gone versus continuing to talk about it and mowing them. And then the root grows back because we get triggered by people or we find ourselves in familiar situations and we don't know why. We just do.
Yeah.
It's comfortable.
Yeah, that's really good to know, because I feel like a lot of people do just go to like, oh, someone died, or I was in an accident, or I was sexually abused, and not the little things of like, why do I act this way, or anxiety, little things like that.
Why do I have a fear
that's not
of
little, but
public speaking,
Right.
or performance anxiety
Yeah.
before I go and do this task? Like, why am I dealing with that?
Right.
Right. That comes from somewhere.
Yeah.
Yeah.
Yeah, that's great to know. Thank you for sharing that. One last question I have for you ladies. What are some tools that listeners can try today to start healing?
Like self-tools, resourcing. I think one of my favorite ones that's just kind of an easy one to describe is the 5 senses technique. Have you ever tried that one?
I have.
I
Yes.
love that one.
Yes.
And my clients love that one. We use it all the time. I love it because you can do it inside, outside. You can do it anywhere, in a different room. You can do whatever. So it's where we use our 5 senses to get just grounded and connected to our environment. So we might start with our sense of sight, just look around the room, see if you can notice 5 things that you haven't really noticed before in this room, or 5 old things, or 5 green things, or just whatever. Just notice 5 things and describe them, and like what they look like. And then 4 things that you can touch. And maybe it's going to be just anything, and you're just going to notice the texture of each of the things, or maybe it's 4 cool things, 4 warm things, 4 rough things, 4 smooth things, soft things, whatever. 3 things you can hear. Just tune in. And you'll find that when we're quiet for a moment, we hear there's traffic on the road. Or we hear the ceiling fan. Or we hear the white noise machine that's out in my hallway. We hear all of those different things. Muffled voices talking down the hall. 2 things.
Dogs barking.
Dogs barking, right. Maybe we hear the wind, I don't know. 2 things that we can smell. So you can go find something to smell. I've had people are hilarious. They're like, I had somebody smell their armpit. People smell their hair or their clothes, their drink, or if you're outside, I'm going to smell these flowers, or whatever. But yeah, I mean, you got to get innovative, man. Especially if you're on telehealth and you're in this little tiny spot. You're sitting right here. Well, what can I smell?
Right.
And then 1 thing you can taste. And you can do it in any order. I like to use that order. I think that's the easiest, like trying to taste 5 things.
Right.
Unless you're standing in front of the fridge and you want to do it that way. That's fine too.
Yeah. That actually really helped my mother-in-law after my husband died. She told me that was one technique that would really help her when she'd get into those like super emotional, just like spells. She would have to do that a lot, especially while driving. So
I love that one.
That is too. I love to. I'll have people count backwards from 10 to 1 before they ever respond. So just really starting to slow your brain down, that you just want to react, and before you ever speak, count to 10.
That's a good one. Yeah. That's a really good one. I'm going to start using that with my kids, because sometimes I just like say things and I'm like, oh my God, why did I say that? Yeah. And it's gotten so much worse after Eric died. I'm like, I'm a monster. So I'm going to try that one. Well, thank you ladies so much for meeting with me and sharing all that information today.
Yeah, absolutely.
Thank you for inviting us.
Of course.
Searching us out.
Yes, I know. I'm so happy we connected. Yeah, and I'm so happy you could answer those questions better than I could. When people are like, what is that? What does it do? I'm like, I don't know. Just do it, guys.
It's fun to talk about what we love.
Yeah,
so thank you for
absolutely.
giving us the opportunity.
It is. And thank you guys so much for being here. If you want to continue to be a part of these conversations, make sure you like, share, subscribe, do all the things, and don't forget, just for today, keep going.